There are times in our lives when, due to health problems or age, we find we need help in our homes with things we could previously do on our own. Or we may need to hire someone to help care for older relatives or a family member who's sick. Thankfully, there are good caregivers and agencies that provide in-home services to help meet those needs. Unfortunately, problems can come up when a caregiver comes into your home and has access to medications, confidential information, or personal property. By making this video, we want to give you the information you need to help you make good decisions about hiring an in-home caregiver, avoid problems, and know who to call if problems do occur. We also want to encourage you to think about these issues and become familiar with these resources before they are needed. Planning for future needs will make the process much easier when the time comes to hire a caregiver.
What kind of caregiver do I need?
Deciding what kind of assistance you need will help you determine the type of caregiver to hire. Do you need help with household chores like cooking, cleaning, laundry, and shopping? If so, you may need a housekeeper to help perform basic chores. Do you need help with bathing, eating, dressing, toilet assistance, and getting around the home? You might need a personal care assistant. Do you need help with health management issues, such as medications, injections, IV therapy, wound care, and diabetes treatment? You may need a home health care worker, a home health aide, a certified nurse assistant, or a nurse's aide. These people can provide personal care, help with bathing, transfers, walking, exercise, healthcare services, and medications. They may also have special training and qualifications to provide more complex services under the supervision of a nursing professional. Or you may need skilled nursing care from a registered nurse, a licensed practical nurse, or a therapist, such as a speech, occupational, or physical therapist.
How will I pay for in-home care?
Before you pay for a caregiver out of pocket, make sure you explore all your options. Some in-home services may be covered through private health insurance, Medicare, Medicaid, or other public programs. Generally, Medicare is available for people aged 65 or older, younger people with disabilities, and people with end-stage renal disease. Medicare covers home health care services, including skilled nursing care and certain other services for the treatment of illness or injury, if the individual receiving care meets 4 conditions. 1. The individual's doctor decides that in-home health care is needed. And 2. The individual must need either part-time or intermittent skilled nursing care, physical therapy, or speech-language pathology services. And 3. The individual must be homebound, which is defined by Medicare as a person who is normally unable to leave home or leaves home infrequently for short times or for the purpose of getting medical care. And 4, the agency providing health care is Medicare approved. If these 4 conditions are met, Medicare may cover skilled nursing care on a part-time or intermittent basis. Medicare can also cover physical therapy, speech-language pathology services, occupational therapy, medical social services, certain medical supplies, and medical equipment, as long as the individual is eligible and the doctor prescribes the services. Medicare may also cover home health aid services or personal care on a part-time or intermittent basis, only if the individual receiving care is also receiving skilled nursing care or another type of therapy. In that case, the home health agency directly bills Medicare, and Medicare pays the full approved cost of all covered home health visits. Here are some things Medicare does not cover. Medicare does not cover 24-hour-a-day in-home care, home-delivered meals, homemaker services, or personal care given by a home health aide, unless skilled care services are also being provided. Usually, Medicare only pays for temporary in-home care after a hospital stay or nursing home stay to help a person transition back to the home. It is generally time-limited for 6 weeks or so. For more information about Medicare, go to www.medicare.gov.
If you have limited income and assets, you may be able to receive services from a home health agency through traditional Medicaid if you meet financial and other eligibility requirements. Traditional Medicaid can pay for services provided by a registered nurse, home health aide, or renal dialysis aide employed by a home health agency if those services are ordered by a physician, provided as part of a physician's plan for treatment, intermittent or part-time health-related nursing care, medically reasonable and necessary, and provided to persons who are medically confined to their home. Medicaid will only cover home health services if the patient has received prior authorization for that care from Medicaid. Traditional Medicaid does not pay for homemaker, chore, or sitter companion services. However, those services may be available through the Medicaid Waiver Program. The Medicaid Waiver Program is designed to help people live in the community and avoid institutional care. The Choice Program also provides a wide range of in-home services to people aged 60 and over or people with disabilities who are at risk of losing their independence. Among the many services available through Choice are attendant care, home modifications, homemaker, and health care, and private duty nursing. Both Medicaid Waiver and the Choice Program often have wait lists, meaning that finding help to pay for immediate care needs may be difficult. The best way to get information about in-home services available through traditional Medicaid, Medicaid waivers, and Choice, and how to pay for those services is to contact your local area agency on aging. For Monroe and Owen counties, call Area 10 Agency on Aging at 812-876-3383 or visit their website at www.area10agency.org. If Medicare and Medicaid will not cover the services you need, you may have to pay for them with your own funds or through private insurance. Medicare supplemental insurance, aka Medigap plans, do not cover in-home health services, but may help with copays for Medicare-approved intermittent care that Medicare is already covering. Check with your supplemental Medigap health insurance to determine what services are covered under your plan.
Long-term care insurance is a separate private insurance policy purchased to pay for catastrophic expenses. Depending on the plan purchased, it may cover home health care and/or personal care. You must carefully read plans to ensure the coverage you want is included. There are veterans benefits that pay for in-home care for qualified veterans who apply. Services may also be available to the spouse of a veteran. Your local Veterans Benefits Office can assist you with any questions or with the application. The Monroe County Veterans Affairs Office can be reached at 812-349-2568 or through the county's website at www.co.monroe.in.us.
The Area 10 Agency on Aging offers a variety of additional services to people who are homebound, including home-delivered meals, a mobile food pantry, and the Caring Companions program, which matches volunteers with people who are homebound to help with a variety of tasks, including errands, shopping assistance, light housekeeping, and more. Area 10 also offers the AARP Money Management Program, providing trained volunteers to help people with budgeting and paying bills. You can contact the Area 10 Agency on Aging by calling 812-876-3383 or visit their website at www.area10agency.org.
Meals on Wheels is sponsored by IU Health Bloomington Hospital and serves people in the Bloomington city limits for a fee. Contact Meals on Wheels at mow@bloomhealth.org or call 812-876-3383.
Should I use an agency or hire a caregiver on my own?
Your next decision is whether to use an agency that provides caregiver assistance or to hire a caregiver directly on your own. There are advantages and disadvantages to consider. Although it may cost more to go through an agency, agencies provide services and address issues you may not be prepared to deal with on your own. Let's talk about some of the advantages and disadvantages of using an agency versus hiring a caregiver directly. Here are some advantages of hiring your own caregiver. It may be a less expensive option if Medicare, Medicaid, or other insurance will not cover the services. You get to personally select the caregiver. There may be greater flexibility in the caregiver's work schedule and responsibilities. Here are some disadvantages of hiring your own caregiver. The time, cost, and effort to advertise, interview, check references, and select the caregiver can be extensive. An individual caregiver has no supervision or training from an agency. There's no coverage when a caregiver is absent. As the employer, you will be responsible for payroll, including deductions and taxes and insurance coverage, such as workers' compensation. Here are some advantages of hiring a caregiver through an agency. All of the hiring, firing is done by the agency. You don't have to worry about being an employer. Caregivers should be supervised and screened. Agencies often do criminal background checks and/or drug screens. There is typically 24-hour, 7-day-a-week backup for caregivers. The agency serves as employer and handles payroll and tax issues and insurance coverage, such as workers' compensation. Here are some disadvantages of hiring a caregiver through an agency. Using an agency may be more expensive than self-hiring a caregiver. This can be a big concern if paying for services out of pocket. You may have less choice in selection of the individual caregiver. Individual caregivers may alternate. We hope this helps you think through the advantages and disadvantages of using an agency versus hiring a caregiver on your own.
How do I hire a caregiver?
When hiring a caregiver, it is important to know what you are looking for. First, make a list of the specific services you expect a paid caregiver to perform and the hours you wish to have help. What kind of training is needed? Are any language or other special skills needed? Is experience working with memory impairment or other disabilities required? Will the caregiver need to lift the care recipient or operate any special equipment? Will the caregiver need a valid driver's license? Next, get referrals. Area 10 Agency on Aging operates an Aging and Disability Resource Center that was created to offer a simple, one-stop shop to find information about long-term care and supports for older adults and people with disabilities. Area 10 keeps a registry of home care agencies, individuals, and volunteer groups, and has certified counselors to help with questions about Medicare, Medicaid, and long-term care insurance. Contact Area 10 to find out about local resources to help meet your needs. Other sources for referrals may be doctors, social workers, and hospital discharge planners. Some caregivers are listed in the phone book under home care or home health care. If Medicare will be covering the services, be sure to look for agencies that say they are Medicare approved. You can search for Medicare approved agencies on www.medicare.gov. The Medicare.gov website has a section called Home Health Compare. You can search for information about home health agencies by zip code, city, or agency name. You can find out what services each agency provides, as well as compare the quality of the agency's services to state and national averages in areas such as managing daily activities and preventing harm. If hiring a caregiver on your own, try to get referrals from friends, family members, or through groups such as churches. You can also try advertising in the Help Wanted section of the local paper. Request a resume and at least 2 references. Remember, do not list the address or phone number of the person needing in-home care. consider using a post office box or a temporary cell phone number if necessary. For safety reasons, it's best not to publicly disclose the address of a potentially vulnerable person.
Before you schedule a face-to-face interview with any applicants, do some initial telephone screening to determine if the applicant is appropriate for the position. When you call an applicant on the phone, block your phone number from appearing on their caller ID by using the code *67. This is a valuable safety tip to preserve your privacy. Describe the job to the applicant, including specifics such as work hours and wages. Ask the applicant about their past work experiences and if they have reliable transportation. If the phone interview does not go well, it's not necessary to schedule a face-to-face interview. Instead, thank the person and tell them you are doing other interviews and may get back with them. Do not give your name and address to people you do not intend to interview. If you are satisfied that an applicant sounds good, then you can schedule an in-person interview. Request that the candidate bring contact information for 2 or 3 references and a valid driver's license or other proof of identity. If applicable, ask them to bring any professional licenses or training certificates.
Now comes the interview. Have candidates fill out a simple job application form with basic information. Don't let a stranger into your home without another person present. That person can also help you assess the applicant. During the interview, give the applicant a list of your needs. Discuss the services you expect the applicant to perform. Note anything the applicant is not willing or not trained to do. Be clear about your expectations, the salary, and time commitment. Look for someone with the experience with the type of tasks you need them to perform. Try to assess as much as you can about the applicant based on their responses. And take some notes so you can remember what happened in the interview. Did the applicant appear on time and present themselves well? Did the applicant seem patient, compassionate, flexible, and trustworthy? If you are hiring a caregiver for someone else, it may be a good idea to see how the applicant interacts with the person they will be caring for. Do their personalities match? How do they get along? It is a good idea to write out a list of questions and ask the same questions of each applicant. This will help you compare applicants later. Here are some questions you may want to ask. You may also have other questions based on your particular needs and circumstances. Have you ever worked as a caregiver before? Who did you work for? How and why did that job end? What kind of special training, if any, have you had? What types of work do you enjoy and not enjoy? Have you ever been arrested for or convicted of a crime? Provide details. Would you be willing to provide transportation to doctor's appointments or other outings? Is there anything in the list of needs that you can't or won't do? How long do you plan to stay at this job? Will you provide at least 2 weeks' notice before quitting? Are there any problems with the days or hours that I need you to work? Can you work on weekends and or holidays? And do you have reliable transportation?
Anytime you hire someone to come into your home and work, there's going to be risk. This is especially true for hiring an in-home caregiver. So it's not enough just to ask for references. You must check them. Never hire someone without checking their references. It is not advisable to hire someone who has no references. Speaking directly to former employers is far better than accepting letters of recommendation. Here are some suggested questions to ask references. How long have you known the applicant? What was their position with you? What were their job responsibilities? What did you think of the quality of their work? Were they reliable and trustworthy? Were there any problems? Why are they no longer working for you? And would you hire this person again?
Hiring someone to come into your home means that person will have easy access to your personal property, documents, and medications. That means you need to hire someone that you can trust. It is a good idea to get a criminal background check and compare it to information that was provided during an interview. A criminal record can raise concerns about someone's honesty and trustworthiness and potential drug and alcohol abuse issues. If there is information revealed in a criminal background check that was not disclosed during the interview, that is also a cause for concern about someone's honesty. You can request a criminal records background check from the Indiana State Police on their website at www.in.gov/ISP and follow the link to limited criminal history. You can also check mycase.in.gov in participating counties to get information about someone's involvement with the court system. Even if the person does not have a criminal record, you can learn whether the person has current financial problems leading to lawsuits by creditors, a potential red flag.
What do I need to know about employing a caregiver?
Once you've decided to hire someone, call the other applicants to let them know. You may want to ask qualified applicants if they'd be interested in working as an emergency backup and keep them on file for future reference. It's a good idea to give a new caregiver an orientation before they actually begin work so they understand the routine and expectations. If a caregiver is going to be later absent, emphasize the importance of being notified as soon as possible so you can make alternate arrangements. Keep a list of people who can provide backup care if necessary. Be clear about the employee's salary, when they will be paid, and reimbursements for money a caregiver may spend out of pocket. Set up a form for recording payments to the caregiver and always pay by check instead of cash so there's a record of the transaction. Agencies typically handle verification of their employees and administer payments, but if you hire a caregiver on your own, you'll be responsible as the employer of a household employee. That means you may be responsible for withholding taxes, Social Security, and unemployment insurance. For more information on these requirements, you can look at the Household Employers Tax Guide, publication 926 from the Internal Revenue Service. You can find that at www.irs.gov. Some caregivers may be considered independent contractors responsible for filing their own taxes and purchasing their own insurance policies. Even if someone is an independent contractor, you must still issue Form 1099-MISC for miscellaneous income if you pay the individual more than $600 a year. If you have questions, it's always best to seek advice from a tax professional.
Are there steps I can take to prevent problems with caregivers?
Unfortunately, people sometimes run into problems with caregivers in their homes. These problems may include identity theft, financial exploitation, and theft of property or medications. There are some simple steps you can take to help prevent problems. Unless the caregiver will be administering medications, don't leave medications out in plain view. In fact, it may be a good idea to have medications hidden or locked, or stored elsewhere by a trusted third party as an extra security precaution. Dispose of unused, expired, or unwanted medications using the Monroe County Pharmaceutical Safe Disposal Program drop box. Learn more about this program by visiting the prosecutor's office website at www.co.monroe.in.us/prosecutor. Lock private papers and valuables in a file cabinet, safe deposit box, or safe. Make it clear that the caregiver may not bring anyone else into the house. Make arrangements to have a trusted friend or family member pick up the mail or have it sent to a post office box where it can be picked up at a later time. Ask a friend or family member to stop by unannounced periodically to check and see if everything is okay. Review all bank and credit card statements at least once a month. Periodically, request a credit report from one of the 3 major credit bureaus. Have Social Security or pension checks deposited directly into the bank account. Check the phone bill for unauthorized calls. Protect checkbooks and credit cards and never make them available to anyone you do not thoroughly trust. Don't allow the caregiver to pay bills or have access to the checkbook. Always get receipts anytime the caregiver shops for the care recipient. Never add the caregiver's name to savings, checking, charge accounts, or any other documents. Don't make loans to caregivers. Make sure the caregiver has emergency contact information.
Who can I call for help if I do have a problem with a caregiver?
If you believe that you or someone else has been the victim of a crime committed by a caregiver, such as the theft of personal property or medications, abuse or neglect, contact the police to report it so they can conduct a criminal investigation. Call 911 to report the problem. Also, the Office of the Monroe County Prosecuting Attorney operates the Adult Protective Services Program. Adult Protective Services investigates reports of abuse, neglect, and exploitation of endangered adults and can take legal action to protect elderly or disabled crime victims. If you are aware of an endangered adult harmed or threatened with harm, you have a duty to report such information to law enforcement. You can make a confidential report of an endangered adult by calling Adult Protective Services at 812-349-2665 or the Indiana Adult Protective Services hotline at 1-800-992-6978 or visit Adult Protective Services at the Monroe County Prosecutor's Office website at www.co.monroe.in.us/prosecutor. If you have hired a home health care provider through an agency licensed by the Indiana State Department of Health, you can call the Indiana Home Health Care Complaint Line to report the issue at 1-800-227-6334.
Thankfully, there are good caregivers and agencies who provide quality in-home caregiver services when we need help. Unfortunately, there can also be problems that come up when a caregiver comes into your home and has access to medications or personal property. We hope this video has given you the information you need to make good decisions about hiring an in-home caregiver, preventing problems, and knowing who to call for help if you do run into problems. Thank you for learning what you need to know about hiring an in-home caregiver.